This is Sidhwani, clinical psychologist and psychotherapist. I have been practicing in the field of mental health and psychology for the last 15 years. Today I want to talk about depression. So what are some of the signs and symptoms of depression? Depression is a prolonged state of sadness which we feel for at least 2 to 3 weeks. This sadness does not go away although we divert our mind or indulge in fun activities. So the constant feeling of low comes with constant crying spells. Some patients report a lack of sleep or insomnia. They are not able to sleep because they are having constant negative thoughts. On the other hand, we also have people who sleep excessively and shut down to the world in their depression. One of the other symptoms of depression is appetite. So your appetite can increase, while for others it may also decrease, and they may not feel like eating when they are feeling low. Depression leads to a dysfunctional life. So we do not enjoy our day-to-day activities of yoga, exercise, going out, talking to people. So there's a complete disinterest in self-care and also other care. So how does one handle depression? Depression, to remember here, is a chemical imbalance of certain hormones in the brain. And therefore we call depression an illness. The two treatments for depression are, one is psychotherapy, which is going for counseling sessions to a licensed therapist. Two is going to a psychiatrist and taking some antidepressant medications. Now most people have a fear of taking the antidepressant as they feel that they will get addicted to it. So here I would just like to emphasize that antidepressants are not addictive, and slowly they are weaned off by the doctor as the patient starts improving. Side by side, we can also do counseling sessions and build the confidence and the self-image of the person. There are many causes of depression. That in neuropsychology there is a biological cause of depression. But depression is triggered by certain life events. The loss of a parent, loss of a spouse, any trauma, accident, loss of a job, a pandemic today has created a lot of depression. Now how can all this be reversed? Depression is an entirely treatable illness, and therefore one should continue therapy as well as medication if required. In cases of mild and moderate depression, the patient can be handled only in therapy and may not require any form of medication. A lot of times we also see that depression can lead to extreme negative thoughts of suicide. So you feel hopeless, worthless, life seems out of control, and everything seems awful and catastrophic. So these are negative patterns and automatic thoughts which come in a depressed person's mind. It is difficult to control these thoughts, and often what we have seen that these thoughts overwhelm the person to the extent that his day-to-day routine is affected. So suicide is not something that is not always an impulsive act. Most suicides are planned, and most patients actually voice out and give us signs that they are feeling so unwell that they feel like ending their life. So here it is very important to pick up the signs, and also if somebody is complaining or talking to you about ending their life, please take it seriously and consult a doctor. We have seen through therapy and medication that depression is extremely curable and treatable. Thank you.